after progression on enfortumab, our options include erdafitinib. Let's not forget, it's an orally administered small molecule inhibitor against VEGFR. And it is approved for patients with selected FGFR2 and FGFR3 mutations, which represent about 15 to 20% of all patients with advanced disease. So that's an effective option that we should reach for patients that are biomarker positive. And then obviously importantly in that third line and beyond setting after enfortumab, clinical trials will then become kind of the preferred option. And there are a number of studies looking at novel immune targets, other ADCs. Sacituzumab govitecan is currently still in development, and there's a TROPiCS study that is currently evaluating that as well. So there are trials of novel agents and other immunotherapies, but I would generally counsel patients toward clinical trial options.